My name is Tessa Kritikos, and I'm a postdoctoral fellow at Loyola University Chicago. Our paper, Psychosocial Adjustment in Emerging Adults with and Without Spina Bifida, a 14-year follow-up study, appears in the Journal of Developmental and Behavioral Pediatrics. This project was funded in part by research grants from the National Institute of Child Health and Human Development, the March of Dimes Birth Defects Foundation, and the National Institute of Nursing Research. We also want to thank the Illinois Spina Bifida Association, as well as staff of the Spina Bifida clinics at Ann and Robert H. Lurie Children's Hospital of Chicago and Loyola University Medical Center. Our research team is led by Dr. Grayson Holmbeck, and our research projects focus on understanding family, psychosocial, and neuropsychological functioning for young people with spina bifida over time or longitudinally. The goal of the current study was to examine the psychosocial adjustment of individuals with spina bifida during emerging adulthood, that is, ages 22 to 23, and to compare this adjustment to a matched sample of emerging adults without spina bifida. A lot of the research we have available on emerging adulthood and chronic illness is cross-sectional and/or does not include comparison groups. So what we aimed to do in this study was conduct a 14-year follow-up from 2 prior studies we've completed when participants were 8 to 9 years old and 14 to 15 years old. So participants in this study included 56 emerging adults with spina bifida and 62 emerging adults without spina bifida. All of these participants were part of a longitudinal study and had previously participated in our earlier studies. So quickly, what is spina bifida? Spina bifida is the most common congenital birth defect affecting the central nervous system. It's caused by an incomplete closure of the neural tube during the early stages of pregnancy. And we know that individuals with spina bifida face motor and sensory neurological deficits, bowel and bladder incontinence, hydrocephalus, orthopedic conditions and pressure injuries, as well as cognitive and academic difficulties, mental health difficulties, and social difficulties. So in this present study, we really wanted to focus on important constructs that are very relevant during emerging adulthood. Things like financial independence, marital and parenthood status, engagement in volunteer work, satisfaction in romantic relationships, transportation methods, independent living, and identity development. We found that there was a lot of continuity from earlier development in the challenges faced by the spina bifida group. Our findings show that when compared to their typically developing peers, individuals with spina bifida had fewer family and peer supports, less decision-making responsibility, greater parent-youth conflict intensity. And they were less likely to have had sexual intercourse, less likely to be married or living with a significant other, less likely to have ever dated, to currently be dating, or to currently have a boyfriend or girlfriend. And no one in our spina bifida sample had children. In the educational domain, young adults with spina bifida were less likely to be in college or employed, and they had lower levels of education and lower levels of expected education. In terms of finances, they were less likely to be living independently, less likely to own a car, and had less overall financial independence. And then finally, in the health domain, they were less likely to eat vegetables and fruits, less likely to exercise, and less likely to attempt to lose weight when compared to their typically developing peers. However, we were encouraged to find several areas of potential resilience for adults with spina bifida. First, their identity development was mostly on par with their typically developing peers. Second, although they reported fewer social supports, there were no differences in the quality of their social supports. And third, in terms of problem behaviors and symptoms, they had either similar levels or lower levels of problem behaviors than their peers. They had similar perceptions of body image. And by young adulthood, they weren't showing greater vulnerability to depressive symptoms, despite this being a comparative vulnerability when they were younger. These findings are reassuring and highlight potential strengths that we could bolster in young adults with spina bifida. So in terms of what this study contributes to the literature and the clinical implications of our findings, understanding the strengths and vulnerabilities that emerged in our findings can equip providers with a developmental framework for supporting young adults with spina bifida. Practitioners should be aware of vulnerabilities in emerging adults with spina bifida. This way, they can thoroughly assess these areas of psychosocial functioning and advocate for young adults with spina bifida to have continued support in areas in which challenges still remain. Providers should also address the likely contributors to these challenges, including things like parenting styles, stereotyping, executive functioning, and structural barriers. At the same time, practitioners can partner with their adult patients with spina bifida by appreciating areas of strength and harnessing assets such as high-quality social supports to bolster resilience.